Hello everyone, my name is Dan Trongone and I'm a wellness coach with ACI Specialty Benefits. During this Apple Core Wellness presentation, we will review basic cancer information and provide you with very important guidelines for this prevention. To better understand cancer, we will cover cancer facts, rates, and biology. We will also discuss some common types of cancer such as breast cancer, lung cancer, skin cancer, and prostate cancer. Finally, we will cover the very important topic of cancer prevention through nutrition and exercise. In 2011, there will be more than 1.5 million new cancer cases. 4 out of 5 of these newly diagnosed cases occur after the age of 55. Alarmingly, cancer causes more than 500,000 deaths a year. 1/3 of all cancer deaths have been related to an individual being overweight, physically inactive, and or having poor nutrition. A basic understanding of cancer formation is when an individual experiences uncontrolled cell growth leading to the formation of a tumor. Tumors can then invade and destroy normal cells. This uncontrolled cellular growth can be caused by or linked to genetic mutations, such as an alteration in the DNA sequence, or there's viruses, environmental carcinogens, and or lifestyle. The most common types of cancer are prostate cancer, breast cancer, lung cancer, colon and rectal cancer, and skin cancer. There will be an estimated 240,890 new cases of prostate cancer diagnosed this year. 3 major risk factors contributing to prostate cancer include being an African American man, being a man over the age of 50, a diet that is low in fruits and vegetables, but high in red meat, and high in fat dairy products. Early detection of prostate cancer is very important and can be done in 2 ways, a PSA and a digital rectal exam. There usually are no symptoms associated with early prostate cancer, so it's important to get screened if you are at risk. Symptoms of advanced prostate cancer include low back pain, difficulty urinating, blood in your urine, and weakness or numbness in the legs or feet. Prostate cancer prevention begins with proper diet and nutrition. Try to reduce your red meat and high-fat dairy consumption as possible. Choose lean proteins like chicken, turkey, fish, beans, and nuts. If you must have red meat, select leaner cuts like sirloin. Switch to lower-fat dairy products such as low-fat cheeses, non-fat milk, or non-fat yogurt. Try to increase your amount and variety of fruits and vegetables. Aim to get 5 servings of fruit and veggies a day, or aim to make half of your plate fruits and veggies at each meal. Choose whole grains over refined grains. For example, oatmeal, brown rice, quinoa versus white bread, sweetened cereals, and pasta. Regular screenings are very important. Always consider your risk factors and consult your physician about whether to be screened for prostate cancer. A regular PSA screening is recommended between the ages of 40 for high-risk males and 50 for average risk. Breast cancer is the most common cancer among women in the United States, other than skin cancer. It is the second leading cause of cancer death in women, after lung cancer. The chances of a woman having invasive breast cancer sometime during her life is just under 1 in 8. This year, approximately 230,480 women will be diagnosed with breast cancer. Being aware of this statistic and having knowledge of preventative measures had led to a survival rate of approximately 2.5 million individuals. The first line of breast cancer prevention is knowledge of warning signs. Be aware of lumps or swelling in the breast. Monitor redness, scaly or thickening of the skin, and be attentive to any discharge coming from the nipple region. The most effective way of surviving breast cancer is early detection. Conduct self-breast exams, have a physician examine your breasts, and regularly schedule mammographies. The most common risk factors for breast cancer are women over the age of 50, women who have no children and have never breastfed, women who gave birth to their first child after the age of 30, women who have a family history of breast cancer, women who are overweight or obese, and finally, women who experience early sexual maturity and or late menopause. If you're a woman with 1 or more risk factors, it is important that you have knowledge on preventative measures you can take. Always exercise or be as physically active as possible. Maintain your ideal body weight. Follow proper nutrition guidelines. Consume more of a plant-based diet full of fruits and veggies and whole grains. Limit your alcohol intake. Try to avoid postmenopausal hormone replacement therapy. And finally, and possibly most important, always get regular screenings. Not counting skin cancers, colorectal cancer is the third most common cancer found in men and women in this country. Overall, the lifetime risks of developing colorectal cancer is about 1 in 20. This year, approximately 141,210 people will be diagnosed with colorectal cancer. Risk factors for colorectal cancer include age, over the 50-year mark, a history of colorectal polyps, and a family history. Colorectal cancer is commonly accompanied by warning signs such as rectal bleeding and long-term changes in bowel movements. It is highly recommended that an individual over the age of 50 undergo a colonoscopy for adequate cancer prevention, or earlier if you are an individual with family history of colorectal cancer. Some lifestyle-related factors have been linked to colorectal cancer. In fact, the links between diet, weight, and exercise and colorectal cancer risks are some of the strongest for any type of cancer. With colorectal cancer prevention, you must maintain a proper diet and nutrition. It should be predominantly plant-based. Aim for 5 to 9 servings of fruits and veggies each day. Limit consumption of alcohol and red, processed, fatty meats. Avoid cooking meat at high temperatures, as this can create chemicals that might increase the risk of cancer. Get more exercise to help reduce risk. The American Cancer Society recommends at least 30 minutes of physical activity on 5 or more days of the week. 45 to 60 minutes of exercise on 5 or more days of the week is even better. And finally, maintain your individualized healthy weight. Lung cancer, both small and non-small cell, is the leading cause of cancer death for both men and women. More people die of lung cancer than of colon, breast, and prostate cancers combined. Lung cancer is rare in people under the age of 45. An estimated 221,130 people will be diagnosed with lung cancer this year. Major risk factors for lung cancer include smoking. Tobacco smoke causes nearly 9 out of 10 cases of lung cancer. The longer a person has been smoking and the more packs a day smoked, the greater the risk. However, stopping smoking at any age may lower the risk of lung cancer. Environmental exposures, like asbestos for one, is a leading environmental cause for lung cancer. Smoking is the biggest health hazard of today, and the leading risk factor for lung cancer. The longer a person has been smoking and the more packs a day smoked, the greater the risk. However, stopping smoking at any age may lower the risk of lung cancer. Cigar and pipe smoking are almost as likely to cause lung cancer as is cigarette smoking. And smoking low tar or light cigarettes increases lung cancer risk as much as regular cigarettes. There is a concern that menthol cigarettes may increase the risk even more, since the menthol allows smokers to inhale more deeply. Secondhand smoke. People who don't smoke but breathe the smoke of others may also be at risk for lung cancer. Non-smokers who live with smokers, for instance, have about 20 to 30% greater risk of developing lung cancer. Non-smokers exposed to tobacco smoke in the workplace are also more likely to get lung cancer. Another common cancer affecting a large number of individuals is skin cancer. The epidermis layer of our skin is very thin. It's about 0.2 millimeters thick. That's about 1/100th of an inch, and is very susceptible to sun damage. There are 2 types of skin cancers, or carcinomas. The first type is basal cell carcinoma. This is the most prevalent form of skin cancer. 8 out of 10 cases have this. The second type is squamous cell carcinoma. This form is more aggressive than basal cell cancers, but accounts for only 2 out of the 10 cases. Proper prevention of skin cancer involves you being aware of and understanding the risk factors of skin cancers. So, skin type, if you have fair skin, accumulated sun exposures, for example UV rays, sun sensitivity, possibly caused by medications, pregnancy, previous skin cancer, and or multiple moles. Knowledge of skin cancer signs and when it is most appropriate to consult your physician are very important preventative measures. Consult your dermatologist immediately if you have any of the following pigmented skin lesions: asymmetry, one half is unlike the other half, irregular border, The border of a lesion is scalloped or poorly circumscribed. Color variation. The color of a lesion is varied from one area to another. Shades of tan and brown, sometimes white, red, or blue. And finally, large diameter. Consult your dermatologist if your lesion is larger than 6 millimeters. Skin cancer can be prevented if proper precautions are set in place. Skin cancer prevention begins with wearing proper protection, hats, clothes, sunglasses, using skin protection sunblock with a minimum of 15 SPF, limiting or avoiding sunbathing and tanning booths. Monitor your skin. You should examine your skin monthly to look for any new moles or moles that have changed. And finally, consult your physician if there are any suspicious changes or poor healing of moles or sores. We just discussed 5 common types of cancers: breast, colorectal, lung, skin, and prostate. The most important cancer information you need is Preventative Information Cancer Health Guidelines, which include increasing fiber intake between 25 and 31 grams per day. Increasing fiber is easy with fruits, veggies, whole grains, and legumes. If you're not used to eating a high-fiber diet, start slowly and be sure to drink plenty of water to help with digestion. A good rule of thumb is to use your plate as your guide to healthy eating. Fill 2/3 of your plate with plant foods, fruits, veggies, beans, grains, and the other third or less with animal products. Increasing your intake of plant-based foods will load you up with antioxidants and phytochemicals, which protect the body from certain cancers. Eliminate or avoid saturated fat, trans fatty acids, smoked and procured meats, and alcohol. Increase your physical activity.